So the most common nervous or neurological disorder, one of these multiple sclerosis. Multiple sclerosis is an autoimmune disease where the plaque develop in the white matter of the central nervous system. The pathophysiology of multiple sclerosis, the myelin sheath, this is the myelin, this is the axon. Axon covered by myelin sheath in case of a normal nervous system or tissue. But in case of myelin sheath, multiple sclerosis, the outer layer of myelin sheath is damaged, right? Destruction of the myelin sheath in case of multiple sclerosis. So multiple sclerosis is a demyelinated disorder. Destruction of the myelin sheath. It is autoimmune disease, right? If we go more specific, I said autoimmune disorder where the plaque formation or develop in the white matter of central nervous system. So who is affected most? The age of onset of this disease is 20 to 40 years old. So when you are most active in your life, when you are the most important person in the family, you are the most important mother in the family, you are most important for your children's, this young adult attacked most and more common in the female, right? Women affected more than men and characterized by the period of relapsing and remitting of the disease. So some of the factor affecting the disease or some of the factor triggering the disease, like temperature, especially temperature is extreme. So like if you go in the North Pole because of too much cold, that times the disease is increased, or any stress or injury act as a trigger, or sometime pregnancy induced or fatigue. The symptom of this are patient feel fatigue, depression, numbness, loss of
balance.
Yes, loss of um, balance and diplopia, basically. So eye problem is the most common for this multiple sclerosis, especially diplopia and nystagmus. Muscle spasticity and weakness, or bowel and bladder dysfunction also common. Cognitive change occur. Ear problem is most common, like hearing loss or tinnitus, dyspnea, and fatigue, right? What are the diagnostic tests we have to do? Diagnostic tests are, we say, the MRI, or we say magnetic resonance imaging, or evoked potential studies also help to the patient, or we can see the EEG, means electroencephalography, but MRI is the most prominent, important. The treatment for the patient of this, we use the immunosuppressive agents like cyclosporine. So immunosuppressive agent or cyclosporine is a drug of choice, or prednisolone, the steroid and anti-inflammatory. Muscle relaxant we use like baclofen or dantrolene, right? So this is the most common medication we use for multiple sclerosis. So as I told you, the pathophysiology of multiple sclerosis is the demyelinated or damage the myelin sheath in the axon of nerve. So now, if we sometimes NCLEX board asks this question, in case of multiple sclerosis, patient have to avoid the hot bath because the fatigueness is most common or muscle weakness most common. If they take the hot bath, the fatigue muscle will get more fatigue. The weaker muscle will be most weaker, right? So we have to avoid we tell our patient to avoid the hot bath. The second disease we talked about the Parkinson disease, the Parkinson disease. So Parkinson disease, I said easy way to remember, PD. Parkinson means shortly called it is PD. So P for Parkinson, D for disease. P for Parkinson, D for decrease the dopamine. The Parkinson disease basically decrease the dopamine or lack of dopamine. Dopamine is the neurotransmitter. So the pathophysiology of Parkinson disease may be linked to the environmental or head injuries, okay, or chronic antipsychotic use or decrease the dopamine level. So here, so maybe the linked to the environmental, head trauma, chronic antipsychotic use, or decrease the dopamine. So Parkinson disease is a degenerative disorder, especially the degenerative disease of substantia nigra. So substantia nigra is a small area in the brain. They are responsible for the movement of the body. So you know the Parkinsonian disease, the patient has a movement problem, and substantia nigra is an important play important factor for the movement. As I told you, in case of Parkinsonian disease, it is the degenerative of substantia nigra result in the too little dopamine or too much acetylcholine. So in case of Parkinsonian disease, the patient has a tremor, facial muscle tremor, hand muscle tremor, muscle rigidity, and also slow or shuffling gait, muscle rigidity, and you see the knee joint are flexed forward, hand muscle are tremor, right? And also I said the slow movement, mux-like expression, also drooling or difficulty of swallowing, right? This is the most common sign of Parkinsonian disease or Parkinson disease. So basically, Parkinson disease men affected more than women, but multiple sclerosis, most of the patient, female are most common, right? Multiple sclerosis most common in female, but Parkinson most common in the man, and also more than 50 years old. The symptom of Parkinsonism, as I told you before, but I want to recap it again. Gradually onset, tremor at the rest, muscle rigidity, bradykinesia. It is not bradypnea or bradycardia. It is bradykinesia, means slow movement. And patient has a special type of gait, is called the shuffling gait, right? This is the symptom. Also, patient has a difficulty of swallowing. So if patient has a difficulty of swallowing or they have slow movement, so as a RN, what is our roles? We have to monitor the swallow, right? Because patient has difficulty of swallowing. So food intake, we have to monitor. And also we give them thickened food, right? And also encouraging the patient to sit upright when they eat, and also have suction equipment available on the bedside if need. We also encouraging them to ROM and exercise, right? So motion exercise is encourage them, and also we assist them their daily living activities. We encourage them to do their daily living activities, but always we have to be there. We assist them. Like patient need to wear the dress. There are 2 or 3 color shirt or pant. We have to tell them, please choose which one you want to wear, right? Just single statement, like Alzheimer disease. So now question come, how we have to diagnose is based on patient history, 2 out of 3 common sign symptom. This is the common sign symptom. Treatment is the control the symptom, and also we give them levodopa or carbidopa together. Basically, levodopa is the drug of choice, but levodopa does not transmit inside the brain because of blood-brain barrier. But when levodopa combined with carbidopa can cross the blood-brain barrier. It's a combination, levodopa and carbidopa, and this medication increase the dopamine level in the brain, because the patient decrease the dopamine level. So we have to give the medicine that increase the dopamine level. Levodopa and carbidopa do this. And also we give them the benzotropine. And benzotropine decrease the acetylcholine level. Other medication we use is called amantadine, or we give them the benzotropine, which is decrease the acetylcholine, or is called anti-Parkinson medication with them. Give them. Another disease is called amyotrophic lateral sclerosis, right? So amyotrophic lateral sclerosis, we have to know what it is, what are the symptoms, okay? Even we have to know the nursing care. So basically, this is the amyotrophic or degenerative neurological disorder of the upper and lower motor neuron. So they are progressive. they cause the progressive paralysis. Pathophysiology, loss of motor function. Loss of motor function, who affected most? Usually 50 to 60 years old, and men affected more than women. Same as Parkinson disease, men affected more, but multiple sclerosis, female affected most, right? So, as I told you, they are degenerative neurological disorder resulting in progressive paralysis and eventually causes the respiratory paralysis within 3 to 5 years. And also patient cognitive function not impacted, but there are no cure, right? If progressive type of paralysis, I said progressive type of paralysis, so patient paralysis is increased day by day. And finally, patient is dying because of the respiratory failure or respiratory muscle paralysis. What are the signs and symptoms? Sign symptom, muscle weakness and muscular atrophy, means muscle getting short and short, fatigue, then cramping or muscle twitching. So diagnoses are based on sign and symptom and also magnetic resonance imaging, or we can done by EMG. Treatment option. What are the treatment option? Before to go to the treatment option, I want to say, as a RN, what are the nursing care? So, as I told you, the patient is die because of respiratory muscle paralysis or weakness of the respiratory muscle. So we have to maintain the patient airway. Also, suction equipment always should be bedside or intubed as needed. Monitor for pneumonia or respiratory failure. Always we have to check it. The treatment option. The drug of choice is dopamine agonist, is called riluzolin. This medication slow the deterioration of motor neuron and they extend the patient's life to 3 months only. Other supportive medication, we use baclofen. They have an anti-inflammatory effect, or dantrolene for muscle spasm. Okay, and patient is die within 3 years because of paralysis of diaphragm, and diaphragm is the major muscle of respiratory system. Another disease is super important, is called Guillain-Barré. Okay, Guillain-Barré syndrome. This Guillain-Barré is the major pathophysiology. They are autoimmune, and especially the autoimmune or autoantibody formation without any external stimuli, without any external pathogen. Autoimmune formation again the peripheral nerve myelin sheath, right, is like a multiple sclerosis in Guillain-Barré. So this is a normal nerve cell, outer layer myelin sheath, but the Guillain-Barré, the myelin sheath is damaged. Also in multiple sclerosis, same pathologies occur. In case of Guillain-Barré syndrome, as I told you, the paralysis started for the peripheral muscle, means the paralysis on their hands or feet. But finally, paralysis occurs in the diaphragm, and diaphragm is a major muscle of respiration. Because of paralysis on the diaphragm, patient's severe respiratory muscle weakness start, and patient causes the respiratory failure. And I said the basic pathology of Guillain-Barré acute inflammatory demyelination of the nerve system. Most cases are caused by the precipitating factor, the infection, especially Corynebacterium enteritis. So go back again, who is affected most, or the trigger factor or predisposing factor. If anybody has a Guillain-Barré syndrome, but when any Corynebacterium or GI infection, it is act as a trigger factor. Any major surgical operation, respiratory infection, pregnancy act as a trigger or predisposing factor. Because of this issue, the disease is progressive more. So the major symptom of the disease are ascending type of paralysis. As I told you, the ascending type of paralysis means paralysis started from the hands or feet, then they aggressively increase. Like paralysis start from very small muscle from the legs or calf muscle, then they go to the thigh muscle, then they go to the respiratory muscle, right? The progressive and also ascending paralysis. Dyskinesia, inability to move voluntary. Diagnoses are increase the serum protein in cerebrospinal fluid, increase the serum protein. And also we do the provoked potential studies, slow loss of nerve conduction. Treatment is immunoglobulin, intravenous immunoglobulin. Immunoglobulin means we give them immunoglobulin protein, basically, or plasmapheresis. Basically, blood contain the blood corpuscle and fluid. This is called plasma. So if you separate the blood corpuscle, the resting portion is called blood plasma. The blood plasma contain the immunoglobulin. So plasmapheresis is a treatment option as well, right? And if you give the plasmapheresis, you as an RN, you have to monitor the patient vital sign. So next nervous system disorder are Alzheimer, most commonly asking question in NCLEX board exam. So Alzheimer, we are going to talk about what is Alzheimer disease, the stage of Alzheimer, especially the important component. NCLEX board asks, as a RN, what are the nursing care and also home safety measure and medication. So Alzheimer disease, especially it is, I remember to use the A for Alzheimer and A for acetylcholine. In case of Alzheimer disease, the patient lack of acetylcholine. Alzheimer disease, I said, we have to remember A for Alzheimer, A for acetylcholine, right? P for Parkinson, D for dopamine. So in case of Alzheimer, patient has lack of acetylcholine. Alzheimer disease It is non-reversible, I said, right? Non-reversible dementia. Patient has a major sign symptoms of forgetfulness or dementia, but it is irreversible. Also resulting in the memory loss, problem with judgment, or change in personalities. So I said this is the brain in the normal healthy person, right? But if the patient has an Alzheimer's disease, the brain tissue is shrink, right? If the brain tissue shrinks, the cavity increase inside the brain. You see, enlarge the cavities, and also extreme the shrinkage of hippocampus. This is the brain hippocampus. This is the shrinkaging. Also extreme shrinkage of cerebral cortex. This is called outer layer cerebral cortex. Overall, the brain tissue, especially cerebral cortex or hippocampus, is shrinkage, cavity increase, right? In this picture showing cerebral cortex outer layer, and this layer is responsible for, not layer, this tissue is responsible for information storage, language skill. So if patient has a Alzheimer and this area is shrinkage like this, they have a problem of speak, they have a problem of thinking, or problem of information processing. So damaged this area involved in the thinking problem, planning problem, and remembering problem, right? And hippocampus is this area. They are cortical to the formation of the new memories. But in case of the Alzheimer, this hippocampus is going to shrink and also increase the cavities, and cavity is full filled with a cerebrospinal fluid. So as I told you, in Alzheimer's disease, it is non-reversible change, non-reversible dementia, and resulting in memory loss, problem with judgment, and changing the personalities, behavioral problem, thinking disorder, right? Who affected most? Usually 65 to 85 years old affected male and female is equal. When we take care this kind of patient, we always try to prevent the injuries or falling, right? So as I told you, the prevent falling, because patient dementia or forgetfulness is most common. As a RN, when you give the care, it is important nursing care, maintain the structural environment. So environment is important. If anything damaged them, right? So we have to remove it from the room. So maintain the structure environment, provide the short direction if need, and also repetition is most important because forgetfulness, right? And also avoid overstimulation. Use the single day calendar. Everything we have to write down for them, and provide the frequent reorientation. You have to remind them again and again, and maintain the routine toileting schedule. So what are the signs and symptoms? Gradual loss of cognitive function, then aphasia, right? Difficult of speech, or cannot perform purposeful movement, abnormal movement, aphasia, or forgetfulness or dementia. I want to recap it. What are the nursing care for them? We have to maintain the structured environment. So if anything is sharp, furniture we have to remove. Also provide the short direction. Also, repetition is important. Avoid overstimulation and use the single day calendar to doing their daily living activities. Also provide the frequent reorientation because of forgetfulness, maintaining routine toileting schedule. Because if patient has an urgency of toileting, they will try to get out from the bed and they fall, right? And prevention injury is the most important for elderly or Alzheimer or Parkinson disease patient. If patient stay to the at their home, home safety, another important factor. Home safety is important, right? We have to remove the scattered rag from the home and also install the door lock. And good lighting is important in their room, and particularly on the stair, because stair is an important cause of falling. And also mark the steps is with colored tape, right? And remove the cutter if anything is there. What are how we diagnose the Alzheimer? First of all, history taking, family history, or EEG, or MRI, right? Or scan or CT scan. What is EEG? EEG, electroencephalography, right? So in EEG, it is by EEG we analyze the electrical activity in the brain. Okay, EEG also used to identify any kind of seizure activities, sleep disorder, behavioral change. Okay, and MRI or magnetic resonance imaging. Basically, we, I mean, we before to give it or do it this procedure, we have to assess for allergy to the shellfish or iodine, right? And also assess for the history of claustrophobia, because the MRI device is look like a hole. If patient have claustrophobia, they are not good ideal candidate. Before MRI, we have to remove the patient all kind of jewelries and make sure patient does not have any metal implant like pacemaker, orthopedic joint, or artificial heart valve, right? And CAT scan, another diagnostic test we have to do for the patient. And now go for the treatment option. In case of Alzheimer, what are the medication we use? Most common medication we use for Alzheimer is called the donepezil, DONEPEZIL, donepezil. Donepezil basically prevent the breakdown of acetylcholine and also improve ability to do the daily living activities. Other medication to manage the symptom, and it is called symptomatic treatment or antipsychotic medication we use. Antipsychotic and supportive like memantine or antidepressant we use, or anti anxiolytic medication, right? NCLEX board sometimes asks, in case of Alzheimer, what medicine you anticipate from healthcare provider? Doneprazil or antidepressant or anti-anxiety or antipsychotic medication. Another disease is most common is called myasthenia gravis, right? Myasthenia gravis is a here myasthenia gravis is an autoimmune disease. These are the autoimmune. So autoimmune affect the myoneural junction and also lack of acetylcholine. Lack of acetylcholine. So I said the autoimmune disorder that causes the severe muscle weakness and causes by antibody that interfere with acetylcholine at neuromuscular junction and characterized by period of exacerbation and remission. Myasthenia gravis associated with thymus or hyperplasia as well. So if we make it easy, I want to tell you myasthenia gravis is autoimmune. They affected the myoneural junction and also lack of acetylcholine. So here you can see the neuromuscular junction. This is the one neuron, another neuron is here. Acetylcholine receptor problem. Autoantibody produced here because this is the autoimmune disease. The who affect most? Women 20 to 40 years old more frequently than the men. If men attack usually 60 to 70 years old, myasthenia gravis, at least they're 60 to 70, but female most active age group. The symptom of myasthenia gravis, involuntary muscle weakness, voluntary, right? Voluntary means the muscle which is under your control, like skeletal muscle. Increase with activities and avoid crowd and constipation. And also patient at very initial stage, they have a diplopia. So very initial phase, they have a diplopia, we said. And also here, what are the other disease patient develop diplopia? Multiple sclerosis. So multiple sclerosis and myasthenia gravis, both of them has a problem of diplopia or eye problem or nystagmus. Don't forget it. So symptom, I said muscle weakness, and muscle weakness should be worse with activities. When they do something work, the weakness increase. Double vision or diplopia and dysphagia developed, impair the respiratory muscle, and also dropping eyelids or incontinence. So in this picture showing the eyelid is dropped. So dropping eyelid is a prominent sign. In this baby, eyelid is dropped, right? What are the other signs here showing? The dropping the corner of the mouth, eyebrow drop, and also smooth outer of forehead, right? And finally, impaired the respiration in case of myasthenia gravis. So When and how we have to diagnosis is called positive tensilon test, and positive tensilon test confirm the diagnosis, or we do EMG. So what is positive tensilon test? We administer the endophonium, which increase the acetylcholine at neuromuscular junction. If symptom improve, it is myasthenia gravis. If not, it is a cholinergic crisis or atropine. If cholinergic crisis, atropine is antidote. I want to recap it. So diagnosis of myasthenia gravis is by tensilon test. It should be, if it is positive tensilon test, confirm the diagnosis. So what is tensilon test? Administer the endophonium, which increase the acetylcholine at neuromuscular junction. If symptom improve, it is myasthenia gravis. If not, it is a cholinergic crisis. What are the treatment option of myasthenia gravis? What are the treatment option of myasthenia gravis? Okay, before to go treatment option of myasthenia gravis, I want to tell you the nursing care of myasthenia gravis. So we have to maintain the patient airway because respiratory muscle weakness is most common. So when we go to give the maintaining the patient airway, we have to give oxygen, suction, and intubation equipment always at the bedside. Encourage the patient for rest, and also provide a small, frequent, thick calorie meal. I want to recap it. We have to provide a small, frequent, high calorie meal, and also have a patient sit upright while eating, and always we give them thicker fluid. Otherwise, it can cause the aspiration, right? So here we said here so I said the medication also. So another thing, nursing care, we have to admit the lubricating to the eye. So eye drop, eyelid is drop, so we have to put the lubricant eye drops. Okay, also tape the eye shut at the night. During the night time, we have to put something over the eye because eye muscle does not move and eye will be open. During the sleeping, if eye will open, the chance of develop the ulcer. To prevent the ulcer, we have to tape the eye shut at the night to prevent damage of cornea. What are the medication or treatment? We give them anticholinergic agent because in myasthenia gravis, right, we need to give the cholinergic substance. So anticholinergic agent we give. So it is basically we give them phyostigmine or pyridostigmine or prostigmine or neostigmine. Okay, this is anticholinergic studies agent, pyridostigmine or neostigmine. Also, we give them immunosuppressant agent, immunosuppressant antidepressant agent. So always you have to keep in mind, if we give them anticholinesterase agent, this type of medication have some side effect like abdominal pain, diarrhea, and nausea. If you tell your patient before, they will be aware. It would be easy for them to adjust with the side effect, right? So sometimes some of the patient need some surgical or procedure like plasma. Okay, so this is the uh, note for plasma. I mean, here